Hello there, my name is Sid the Cell. I would like to talk to you about the liver. The liver is the second largest organ in your body. The liver is found on the upper right-hand side of the abdomen, belly, under the right lung and protected by the rib cage. Unlike the kidney or lung, you only have one liver. It is vital that you look after it. You can survive with only one kidney or even one lung, but not without your liver. So what does the liver do? The liver performs over 500 different functions. In fact, it's so important that we cannot live without our liver. Let's take a look at the main things the liver does. The liver stores energy in the form of glucose. This acts as a rapid source of energy. It also helps to keep blood sugar at the right levels. Your liver takes out toxins in your blood. This may have been made by your body when breaking down proteins, or may have been brought into your body through breathing or ingesting something like alcohol, drugs, or other harmful substances. Your liver sorts things out and changes them chemically into what the body can use and turns what can't be used into something that dissolves in blood so that it can be carried to the kidneys. The body cannot control fluid balance in the abdomen. The abdomen, belly, and legs may swell up. One of these fluids in the liver that needs to be balanced is bilirubin, made of the breakdown of old red blood cells, which is needed by the liver to make bile, a fluid essential for breaking down fats. A telltale sign that the liver is damaged is when the bilirubin level gets too high, resulting in the person's eyes and skin to turn yellow, jaundice. Cannot make clotting factors, so you might bleed more easily. Cannot detoxify the bloods of certain chemicals and drugs. Patients with advanced hepatitis may be extremely sensitive to the effects of certain drugs and chemicals. Hepatitis means inflammation of the liver. It can be caused by alcohol, certain chemicals, drugs, and viral infections. Hepatitis C is a viral infection of the liver. A virus is a tiny organism that may cause disease, infection, or inflammation if it enters the body. Hepatitis C infection is not caused by a single virus, but by a family of viruses that can be further divided into 6 different subtypes called genotypes. Hepatitis C is a blood-borne virus. That means that it is carried in the blood and spread through blood-to-blood contact. In some cases, persons with Hep C have no idea how they became infected. The majority of people, however, can identify a likely way. Some practices are more riskier than others. Injecting drugs. If you're injecting drugs and share any equipment that could come into contact with your blood, you can expose others to infection with hepatitis C. This obviously applies to the needle and syringe you use, but also applies to water, filtered, and spoons. Snorting drugs. If you share a rolled-up note or straw for snorting drugs, you risk exposing yourself and others to hepatitis C. This is especially true if your nose is bleeding. Transfusion of the blood and blood products can spread Hep C. Sharing personal items such as toothbrushes and razor blades, where transfer of blood occurs, are low-risk ways to become infected, as are unsafe tattooing or body piercings when equipment is not sterile. Not practicing safe sex is a possible risk for Hep C. Hep C can also be passed on from mother to baby. Once again, this is thought to be a relatively low risk, 1 in 20, but a risk nonetheless. The chances of a baby becoming infected are higher if the mother has both Hep C and HIV. Passing on Hep C to your baby by breastfeeding is not thought to be a risk. You cannot get Hep C from hugging and kissing, holding hands, sharing toilets, sharing crockery or cutlery. So, how do you know if you have hepatitis C? Well, unlike some forms of hepatitis, Hep C is often free of symptoms. In fact, about 95% of people who do have it don't even know they've been infected. Some people may experience anything from flu-like symptoms, vomiting, fever, jaundice, recognized by a yellowing of the whites of your eyes. If you are worried that you have contracted Hep C, you can visit your local doctor or hospital for a blood test. Testing positive to the virus can either mean you may have chronic infection, which means your infection may be ongoing, causing long-term low-grade inflammation in your liver. You may have had Hep C at some stage in the past and successfully fought off the virus, but still test positive. There are a number of ways you can help yourself to cope with hepatitis C. Stop drinking alcohol completely or limit your intake. The more you drink, the more likely you are to develop cirrhosis, which is a scarring of the liver caused by the virus, and prevent blood flowing freely through the liver. Follow a healthy diet. If you do develop cirrhosis, your doctor may suggest a low-salt diet to help reduce fluid retention. Because the damage done to the liver by cirrhosis cannot be reversed, doctors try the treatment as soon as possible to attempt to prevent its development. Be aware of how the disease is transmitted. Hep C is transmitted with blood, so you cannot infect your family or friends through normal activities, such as kissing or by sharing cutlery or crockery.